viewed on the City of Lubbock Facebook page or on mylubbock.us/video. We asked citizens to submit questions over the past few days, and we thank all of you who submitted questions. We got dozens, and for time purposes, we pre-selected a handful of those that have answered for you today. And today's panelists include Dr. Craig Ryan, Coveted Chief Medical Officer, Dr. Mike Reagan, the University Medical Center Chief Medical Officer, Dr. Ron Cook, Public Health Authority, Dr. Ted Mitchell, the Chancellor of Texas Tech University System, Eddie McBride with the Lubbock Chamber of Commerce, Chris Berry with Riversmiths and with the Lubbock Economic Recovery Task Force, Director of Public Health Katherine Wells, Mayor Dan Pope, Councilman Steve Massengale, the co-chair of the Lubbock Economic Recovery Task Force, and Lubbock County Judge Curtis Parrish. So we are going to I'm going to ask each question that was submitted, those pre-selected, and then call on a panelist or two to address those for us. And after all the questions have been answered, I will ask the panelists each to give a closing remark for the public. So let's get started with, and this is a combined question, with cases rising and hospitalization rates high, what can be done about large events such as Cook's Garage, tailgates, concerts, etc.? So I'd like to hear from Chancellor Ted Mitchell, Judge Curtis Parrish, and Mayor Dan Pope on this, please.
I'm muted. Thanks, Lacey. Who do you want me to start?
Yes, sir, that would be great.
Great. Well, thanks, and thanks everybody for having us. One of the things that we have with the Texas Tech University system, as most of you know, we have campuses in Amarillo, Midland, Odessa, Abilene, and out in El Paso. So we have regular meetings with leadership from those different areas. And one of the things that I think is really important for people to understand in Lubbock right now is that if you want a bit of a crystal ball of what things could look like, it's El Paso. They're a bit ahead of us with this issue, and it has become a crisis for them out there to the point that they're putting up tents in the parking lot, trying to take care of folks out there. They're running at over 40% of their hospital's capacities with just COVID patients. And so we need to be very serious about what we're doing here in order to avoid that eventuality. So with things rising here at the university, one of the things that becomes pretty clear with that is we have essential functions and non-essential functions. And the essential functions are the teaching functions, some of the research functions, and the service functions at the Health Sciences Center. So we'll limit gatherings to things related to teaching, things related to the service that we have and the like. On the non-essential side, we have important things going on, but they're non-essential in a situation like this. And that's with all of the different student organizations, Greek life, things of that nature that may be important parts of a student's college experience. But during a time like this, those are the things that we actually would focus on, and we already are focusing on, to limit them and hold off on those types of gatherings pending the time we can round this next curve. So those be the things we're working on at the university level to try to limit the number of groups that we have coming together.
Well, Lacey, I know from the county's perspective, we do still allow gatherings in the unincorporated areas, but we're really encouraging people to take this very, very seriously. I know that's been the encouragement since day one, since we began this back in March. But we're really seeing right now what the impact of not taking it serious is to the economy in Lubbock, to our freedoms here in Lubbock. They're being curtailed by Austin, by orders that are being issued. And so I will say this, is as people do gather, and we're saying that they don't have to not gather, but as they gather, please wear your mask. Please maintain your social distancing. And there's a couple of very good, valid reasons for this. And it's not just to keep yourself safe. And I know a lot of people are saying, well, it's my freedom, it's my choice to wear this or not wear this. I get that. But Lubbock County is we have a three-legged stool in our economy. It's our agricultural economy, it's our education economy with Texas Tech, with Lubbock Christian, South Plains College, and it's our medical community, our healthcare system. Those three things really drive the economy here in Lubbock, and it allows businesses and restaurants to prosper and thrive, and our hotels to prosper and thrive. I'm glad Dr. Mitchell is on this call with us, because if Texas Tech University were in trouble, if Texas Tech University were threatened to shut down, I will tell you, this community would go out of its way to make sure that we support the university. If our agricultural community is in trouble, our farmers are in trouble, this entire community will step up to help those farmers and those growers. Well, folks, our medical community, our healthcare system in Lubbock is in trouble. And it is now up to us as the citizens of Lubbock and Lubbock County to step up and to help care for our medical community. We all depend on it, not just for our own personal care or our parents' care, but our economy in Lubbock County depends on our healthcare system. And so we're asking people, do those things that you can do. Don't have gatherings more than 10. And if that happens, tell people, wear your mask. And for the time being, for the next few months, at least until the end of the year, until we can reevaluate and see where we are with our hospital capacity numbers, we're going to have a stronger presence. Our sheriff's deputies will be out, and they will be looking at these gatherings and making sure that people are doing the right thing. And that's what we're asking. Do the right thing, not for yourself, not for your next door neighbor, but for all of us. We are all in this absolutely together. And so we will be monitoring those. We're going to have a stronger presence at any of these large events, these concerts. I know we've got the Texas Tech Rodeo going to be out this weekend. You are going to see uniformed deputies there. And so we're asking everybody, please abide by your social distancing guidelines, abide by your mask wearing and the other protocols to keep yourself safe, keep your neighbors safe, and to keep this community safe.
Yeah, thanks, Dr. Mitchell and Judge Parrish. It's good to have great partners, and we definitely have great partners. And so the only thing I would add is that beginning tomorrow, we will not be approving any outdoor events for more than 10 people for the foreseeable future. Now, remember that Texas Tech operates under their own set of guidelines as per the governor's order, as do our school districts. But other than that, inside the city, we will not be allowing outdoor events of more than 10 people.
Okay, thank you. And just for the public, we'd like to let you know that we're having some audio issues on our video on demand on the Lubbock website. So for the time being, if possible, please watch the Facebook Live, and we will have a video link ready when this is over, unless the sound gets working again. So let's move on to our second question, and this one is for Chancellor Mitchell. Texas Tech recently announced changes to in-person classes after Thanksgiving and also to the spring break schedule. What other plans does Texas Tech have in regards to COVID safety?
Thanks, Lacey. Keep in mind that this is the time of year where respiratory infections in general go up because people gather more indoors. And so always during the colder months of the year, that's when you see these things spike. And that's part of the reason why you send the students home, so that they can be with their families during this period of time. That's also why we'll push back the start date for the spring semester by a week. And by doing so, we'll keep the kids at home. What we'll continue to do here in Lubbock is we'll make sure that we have extra capacity. We have contracted with hotels in the city to utilize those spaces anytime a student requires isolation or quarantine. We've got places to move them. We will maintain that coming into the spring. That's actually worked out extremely well for us during the fall semester. We'll continue to communicate very regularly with the students' families, with the students, the staff, and the faculty. Everybody right now is experiencing this COVID fatigue where we've all just kind of had it up to here with COVID. So we want to be able to go out and do things. And that's one of the reasons why with this latest surge, unlike previous surges where you could point to a group, in Amarillo, you could say it was the meat packers, or in Lubbock, you could say it was when the students came back after Labor Day, et cetera, et cetera. With this one, it's just this broad increase that you're seeing everywhere from people just getting tired of dealing with it. So we will continue to reinforce through communication with, again, our families, our staff, our students, and our faculty members, the importance of prevention. So it's about communicating about prevention. We'll continue to do that. It's about making sure that we have the capacity to segregate the students as we need for isolation and quarantine. And it'll be about making sure the students are at their home with their families during the most problematic time of year of the virus. So we're going to continue to work on those things moving forward.
Thank you so much, Dr. Mitchell. Okay, now let's move on to another question. Why is the governor's mask mandate not strictly enforced in local businesses? Why can't people be fined for failing to wear one in public? And for this, I'd like to ask the representatives from the LERT group and Mr. Owens with the Lubbock Chamber of Commerce to answer this one, please.
You want me to start on that, Eddie?
Go ahead, Steve.
Good evening, everybody. Lacey, thank you for the question. First, I think I'll use this as a reminder of our Lubbock Safe program. And we have almost 1,000 businesses self-certified in our Lubbock Safe program, and masks are included in the guidelines in that program. We believe with the task force that there probably needs to be some reminders to some of our Lubbock Safe businesses, and we have efforts underway right now to remind them what's required. Now, the governor's order does allow us to fine people for not wearing masks. We haven't taken advantage of that in Lubbock, but as you can see tonight, we are in a very serious situation. And as our situation becomes more serious, if that occurs, then we will certainly consider the ability to fine for not wearing a mask. Eddie?
On behalf of the business community, we really thank the Lacey for the question and for the city putting this on and all of our partners tonight. And we also thank all the folks who sent us questions, and especially those who are joining us tonight. I think it's very important. Appreciate y'all sharing the message beyond tonight as well. As Councilman Maskingale's already said, the best we can do right now at this point in time is to enforce Lubbock Safe by encouraging businesses, encouraging individuals as much as we can strongly encourage them to follow the rules about wearing masks, safely distancing, washing their hands, all the things that have proven to be the best lines of defense. And as Councilman Maskingale said, in the Lubbock Economic Recovery Task Force, we did consider the governor's order about having an opportunity for fine, and we chose not to have that provision whatsoever. And because we thought, because of the personal responsibility amongst all the business people and all the individuals, that we would never even have to consider a fine. So I think it is COVID fatigue. I think we did a lot better first off when we first got started. And as Chancellor Mitchell has just got through saying as well, this COVID fatigue is probably having an impact on folks really finding the necessity to actually wear their mask. So appreciate the chance to answer that question.
Thank you, Mr. McBride. Thank you, Councilman. The next question I think will be best answered from our hospital representatives and from Katherine and Dr. Cook. What hospital facilities are being considered and or prepared to handle overflow patients for COVID or otherwise?
Mike, do you want me to start on that?
Sure, go ahead.
we have rocked along. I showed a graphic to our leadership group today, and we rocked along for about 3 months with a total bed capacity for COVID patients of about 71. And in the past 3 weeks, we have had to expand that capacity all the way up to almost 160 beds at Coveted Medical Center alone. Now, that's just Coveted Medical Center. We have other facilities like Plainview, Levelland that have also stepped up, and they have exceeded the number of COVID positive patients that they ever dreamed that they would be asked to take care of, just like we have here at Coveted Medical Center. We want to continue to cohort patients into Coveted Medical Center as much as we can. We have very carefully and strategically limited the number of COVID positive patients over at the Children's Hospital, but we do have an option, but we have not exercised it yet, of moving non-COVID patients over to the Children's Hospital on a rented wing, if you will. Did in El Paso. So, Mike, your answer?
I think I'm right there with you, Craig. We're seeing a steady increase in the number of inpatient COVID patients. This is far above the seasonal infections that we normally see, and we're running into an issue of problems with staffing because of staff being out because of COVID. I think today we had 237 staff out. As Craig mentioned, there are plans to try and expand capacity. If we used every space that we could gain some additional beds here, up to 160 additional beds. The problem is we can't staff that many beds right now. And so we're being pressured on the staffing side as well. We are very concerned. I think I've heard a lot from the community about, well, there are extra beds, add beds, 2 beds to a room, that kind of thing. That is not feasible in many cases, and it's not staffed. So beds are not the issue as much as having qualified staff available, nurses, respiratory therapists, doctors, to help manage these patients. And so there are limits to what we can do in terms of surge expansion. One of the things that we have done this week, even before the governor's order, we started cutting back on elective cases. And so our OR volume has reduced by about 35% since this week. Much of that was elective cases that we decided to postpone. And so that does help us, but that's not the only answer. The real answer is reducing the number of patients who get infected with COVID. We know that for every 1,000 patients that are infected with COVID, about 20 or 30 of those are going to end up in our local hospitals. And it takes about 2 to 3 weeks for those cases to work into the hospital level. But that's what we've seen pretty consistently over the last month and a half. So as case counts go up, we can expect there are going to be more inpatients, and we are getting to our maximum, as Dr. Ryan said.
Sorry about that. These guys, Dr. Ryan and Dr. Reagan, are the feet on the ground and seeing it front line. We are at a point where they're both correct in saying we've got more beds, but we don't have the people to staff them. We're at this critical standpoint. We're at this critical point. Could we call for extra help? We already started that process of asking more nursing staff, more respiratory therapists, even more physicians to come and help. However, because of all the other issues related in the state, that resource pool is relatively thin. A lot of people that resource pool have gone to El Paso. And as Dr. Mitchell said, that may be our crystal ball. We could ask for those resources. We could ask to have a field hospital set up. That comes with lots of other things related to that. Let's don't go there. Let's try to stop this now. And so we can move forward and not make it to that level of need.
Okay, thank you all. And this question is also for hospital representatives and public health. Who handles the disbursement of additional funds and medical personnel sent by the governor? Do we still have additional personnel here? Will we be getting more?
Mike, I'll go ahead and take a stab at that. We have made a request from the state for additional nursing staff for the reasons Dr. Reagan just outlined. We need caregivers at the bedside to be able to adequately take care of the patients that we already have. We have received about 18 nurses that have been oriented as rapidly as possible and put to work here at Coveted. We did make that request earlier. And it takes time to get them on board. They have to learn our systems. They have to learn our computer systems. They have to be able to take care of patients like any nurse would. And normally an orientation for a nurse takes several weeks, if not months. We're trying to do this within a 24 to 36-hour period. So we have rapidly accelerated that. There are no additional funds. That's a mythology. When we make a request to the state, they can send us personnel, they can send us ventilators, they can send us PPE, they can send us nurses. They don't send us any money. Mike?
I would just say that we have requested staff as well and are standing by to receive them. We haven't yet had any show up, but we're expecting within the next day or two to see some.
Okay, thank you. And this question is also for Dr. Reagan and Dr. Ryan. How can individual citizens and churches help UMC and Covenant in terms of resources?
Mike, you want to go first on this one?
Sure. Well, so as we sit today, personal protective equipment is in a good position. I think that's true more broadly now as the supply chains have improved. So we don't have need for those kind of things at this time. If you want to do something to help the hospitals, it is to help stop the spread of the virus. You know what that looks like. We've talked about that over and over again, but that for any individual in the community, please help us by doing the things that we ask. Masks, hand washing, avoiding large gatherings, all those things make a difference. And you can help us. We know as we go around the community that it's not a high rate of compliance, and we need a better rate of compliance to slow the spread of the virus. That's the number one thing you can do.
Okay. Thank you, doctors. And this question is directed towards Mayor Pope, Judge Parrish, and Doctors Reagan and Ryan again. Why reduce restaurants and bar capacity when there are only a little over 200 in hospitals in a county of almost 300,000 people? Let's start with Mayor Pope.
Yeah, thanks, Lacey. That's an interesting perspective, but remember what we've already heard. It's about our capacity. Our hospitals are staffed to handle a certain amount of emergent medical care, as well as scheduled procedures that require inpatient admissions. We've got to stop the spread. So if my daughter or your mom or your kid were in a wreck or had a heart attack, that they would be able to present at our hospitals and get the world-class healthcare that we expect and that we get day in and day out.
And the mayor's correct. I mean, one of the, when we're looking, and I know there's been a little bit of confusion. I hope maybe that I can probably explain this very, very quickly and concisely. When we're talking about this 15% number and what that means, understand that 15% is just a line in the sand. This was what the governor, through our state health department, had dictated. That is the cutoff line, 15%. That number could be 20, it could be 10. It was just, that was what was chosen by the governor's office, was 15%. But this 15% is the number of COVID patients versus the capacity of all of the hospitals in this 22 county region. So it's not just Covenant and UMC and Gray. This is all of the hospitals in this 22 county area. Now, let me explain just a little bit further. Let's say you have a hospital and it's a 100-bed hospital. That's not its capacity. The capacity is based on what can you staff. Let's say you had a 100-bed hospital, but you only had 3 nurses. Therefore, your capacity, when you're talking about 4 beds per nurse, the capacity of that hospital is not 100, it's now 12. And so if 8 of those patients, or let's say 6 of those patients are COVID patients, then your hospital capacity right now is 50%, because half of the patients in that hospital of the capacity are COVID. So that's how we come up with the number. You say, what can we staff? Now, let me tell you how this becomes very important. We have seen a lot of our healthcare workers, and I know Dr. Reagan, Dr. Ryan can talk a little bit more about this, but we've seen this virus affect our healthcare workers, our nurses, our doctors, our hospital personnel. And so we had a report earlier this week that there were over 400 hospital workers just in this county who can't go to work, either because they're infected or they've had close contact with somebody who is, and they're quarantined. That's 400. And this is something that we can do as a community, keep our nurses safe. Let's make this all about keeping nurses and doctors safe, because if they're able to go to work and take care of us in our community, and as Mayor Pope said, if one of us gets in a car wreck, we really want those doctors and nurses there to take care of us. But if they're out and they're home because they can't take care of us because they've been infected by catching this virus in the community, not only can they not take care of us, but it lowers the hospital capacity. And so if we want to raise the hospital capacity, let's make sure that our doctors and nurses are safe. I can do that. You can do that as well.
And I would like to echo one of the things that Judge Parrish said earlier. We do have a 3-legged economic stool here, and healthcare is one of the largest in that sector. We have more hospital capacity and expertise in Lubbock than you would ever expect to find in a city of roughly 200,000, 300,000 people. But even with that said, with what Judge Parrish just said about the number of caregivers that are out on furlough, we are rapidly approaching our capacity. So the resources to care for this are not infinite. They just are not. And the public needs to understand that when they need those resources, they may not be available if we don't behave responsibly and stop doing the kind of irresponsible social behavior that leads us to have more and more and more cases, as Dr. Reagan has explained. Mike?
Yeah, so I would like to just send a message from our specialty colleagues. I've been talking with neurosurgeons, all sorts of medical subspecialties who are concerned that patients that they normally see from our region of 22 counties are ended up going elsewhere because we're full. I just spent about 45 minutes talking with a neurosurgeon who said that those cases are leaving our region and going to other areas in the state or even outside the state for care. And so the reason that is that we're full. And so when we get every bed taken up, then we don't have a place to put a patient in a bed that's coming from another area. And so it really is having an impact on the medical care across our region. If you think about those 22 counties, many of those patients need specialty care that are only offered at our facilities here in Lubbock. And so those folks are very upset. We heard from the RAC that those regional hospitals are very frustrated trying to move patients they normally would send to Lubbock. they're having to go quite distance for care. And so that is a big problem.
Okay, thank you. And here is a bit of a follow-up question for the hospitals and Mayor Pope and Judge Parrish. If Lubbock hospitals serve 24 counties, why is the city of Lubbock being punished for 15% hospital capacity?
Well, I'll tell you, I've been asked this question often in the last week and a half, 2 weeks. The simplest answer I can give is it's because who we are. You know, I said earlier that our economy in Lubbock County is based on three things: agriculture, education, and healthcare. It is who we are. It is our identity. We take care of people. I mean, I'm looking over here at Dr. Reagan. I'm looking at Dr. Ryan. I'm looking at Dr. Ted Mitchell. These, and Dr. Cook, these are men and women who have dedicated their life to take care of people. We have a world-class healthcare system right here in Lubbock. And it is who we are. We are here to take care of people. And because of that, then we as a community need to take care of the healthcare system, because it will drive our economy. We want our restaurants to thrive and do well. Let's take care of our healthcare system. We want our hotels to be full. Let's take care of our healthcare system. You know, we want our schools to be good and strong. Let's take care of our healthcare system, because we need to take care of the people who take care of us and subsequently take care of the world. It's who we are.
Yeah, just to build on that, I think the judge is spot on. It's a 22 county region, and all counties in that region are impacted by this rollback. So their restaurants, their bars, their hospitals, their gyms, we're all in it together.
Okay, let's switch gears to a little more business-minded question. How will gyms be impacted with the reinstitution of restrictions? I'd like to the alert representatives, please, if y'all would answer this.
Thanks, Lacey. Thanks for the question. So just as a reminder, it's been mentioned a couple times, but when our hospitalization rate triggered this portion of the governor's order, which is Governor GA 32, businesses that were opened back up to 75% pulled back to 50%. And unfortunately, bars were closed. And this also affects gyms. They get rolled back to 50%.
Okay. This next question is directed towards Dr. Reagan and Dr. Ryan. What is the percentage of COVID patients in local hospitals that are from Lubbock County? What percentage are from outside our region?
So I can take a stab at that. We track it by the EMS rack. And so 96% of our COVID patients come from our local rack of those 22 counties.
And I will second that, because we look at that very carefully, and less than 4 to 5% of our patients that are hospitalized right now at Covenant are actually from outside of our region. So we are legitimately taking care of our region to the best of our ability. But again, the number of total cases that we have had to deal with from our region are essentially precluding us from taking care of a lot of the regional hospitals that traditionally send us patients.
Okay, thank you. This next question is for Dr. Ron Cook. If a company has employees that have tested positive for COVID-19, is the company required to notify other employees who might have interacted with those employees that are sick?
Yes, they are, but it could be very generic. When the health department calls, the contact tracer calls, they find out, it's their job to find out who all they've been associated with and nearby and potentially exposed. Now that letter from the employer could be very generic, and it could say, we have a potential exposure. And to protect that individual's privacy, what we would say would then be, say, you may be identified as a potential exposure. If you are identified, you will receive a phone call from the city health department. So it could be that generic. But yes, it's very important that we chase down those individuals that could potentially be exposed and then spread the virus. So we want to make sure that we contain the virus that way.
Okay, thank you, Dr. Cook. And this one is also for you and Katherine. Why aren't COVID-19 rapid tests more widely available? Several testing sites require appointments and results could take days to receive. How can we get more rapid testing sites in the city?
Well, we have a lot of testing available here. The rapid tests are mostly available through our healthcare providers and through the primary care physicians. And that's because they had that equipment available. They owned the testing equipment already, and the laboratories were able to provide the cartridge, which allows those tests to be run. In order to expand that capacity, we need to have more of the testing machines here, and there's a delay to get those. However, we have been able to increase the amount of testing done in our local nursing homes. The feds were able to send out the rapid testing machines to those areas, and we're looking at increasing the capacity of testing at our local schools.
We hope that we will get more testing as it becomes available. It comes to the state first, and then it's dispersed to the communities that need it. Hopefully we'll be able to have more access to rapid testing.
Okay. Thank you, Katherine. Thank you, Dr. Cook. This is our last question. This is for Chris Berry and Mr. Eddie McBride. It may be too early to tell, but from what you're hearing from local businesses and seeing in the data, has consumer spending changed as hospital numbers have risen in the last few weeks?
Thank you, Lacey. So many of us were already experiencing drastic shortfalls of anywhere from 20 to 50%, if not more. Now, the revenue that we bring in, that restaurants and any business brings in on a daily basis, allows us to pay employees, for restaurants to buy groceries, for us to pay our rent, and to pay our taxes. So recently, within the last couple of weeks, many of us have seen additional shortfalls of another 20%, if not more. It's affecting all of us differently, but many of us have seen additional shortfalls. With the pullback being enforced this week, that will just be exacerbated. Those numbers will get even worse. And as it stands today, those numbers cannot be sustainable.
And I want to remind everybody that during the lockdown from January to June, Lubbock area suffered over a 30% loss of consumer spending compared to the state that was a little over 11%. So we have rebounded somewhat through this recent spike. We've had a little bit better sales tax collections from a year ago, but the fact of the matter is, if we continue this spike, if we continue the difficulty with the spread, it's going to cause us obviously to lose that consumer spending again as well. So I think it's very important for not only businesses, but all the individuals, again, to remember that obviously this has a very downward tailspin activity on our spending, as well as obviously on our economic activity. So it's more important that we remember obviously our frontline responders, because obviously those are the ones that are really forced to have to handle the situation, where the rest of us, the best we can do is just mind all the things you're supposed to do as far as wearing a mask, washing our hands. That's the best thing we can do to prevent the spread. So we need to do that so we don't continue to have this loss of economic activity as well.
Thank you both for that. And that's the last of our questions. I'm now going to ask all the panelists to offer a final statement. Dr. Ted Mitchell had to leave us early, so let's get started with Dr. Craig Ryan, followed by Dr. Mike Reagan.
Well, I think the panelists have been in lockstep throughout this entire episode to mention that what we really have to do is pull together as a community. We need to do what we know makes a difference. We know that wearing a mask reduces your chance of getting COVID. To that in the community. We're seeing resistance to limit social gatherings. We've witnessed football parties and tailgating and all kinds of activities that just simply go against what we're fighting. And we've got to have more cooperation from the general public. And they've got to understand that we're not making this stuff up. This is real. This is a critical situation. And if we don't act now, we may not have the opportunity to continue to provide the care that people in West Texas have traditionally come to expect.
Dr. Ryan, thank you. That's well said. I would agree with everything that you said. I do want to highlight that this is hitting home for us as the hospitals. We're very busy, as we've said, very concerned about the signs of growing infection. I saw a statistic reported by the health department today that in a little over 2 months, we've doubled the number of deaths in our county from COVID. We're up to 188 deaths reported this morning. And that's hit home for us. Some of our colleagues have been in that number, and that is very emotionally impactful for the team. Our physicians and our nurses are fatigued. They're very tired from very hard, long work. Some of our hospitalists have worked 21 days straight because of absences because of COVID. So it is having a big impact here. And what Dr. Ryan and I see out into the future is that it's going to get worse. We're just at the beginning of winter, and it is very likely to be difficult for several months to come. So we do need your help. Every single citizen can help us by following the precautions that we've talked about. So please help us.
Thank you, Dr. Reagan and Dr. Ryan. Now, Dr. Ron Cook.
Thank you, Lacey. You know, from the very first press conference that we had out at the fire training grounds, I said we must flatten the curve. You remember that graphic that I had? We've got to push this graph down, which is the number of patients we have in the hospital with the number of beds we have in the hospital. And now we've added the complication of just not having enough staff to take care of these patients. We have excellent hospitals here. We have excellent facilities and physicians and nursing staff and everybody else that takes care of your loved ones. We just can't do it. We're becoming overwhelmed. We're out of room. We've got to flatten the curve. And we still have all the other things that occur in normal daily heart attacks and strokes and car wrecks. And we just had a bad ice storm. And fortunately, most of those turned out okay. But we've got to flatten the curve. We've got to slow down this virus. And we truly only have physical barriers to stop this virus. And those physical barriers are masks, and especially masks with no vents. Don't need a vent on those masks. It needs to work both ways, not just one way. So wear your masks, socially distance, at least 6 feet, if not further. Wash your hands and stay in no groups larger than 10 people. Socially distance, wearing your mask and staying away from people. Help us take care of you and the citizens of our surrounding communities. That's all that I have. We can do this.
Thank you, Dr. Cook. Next, I'd like to hear from Eddie McBride and Chris Berry.
So when the restaurants and bars and businesses were able to increase their capacity to 75%, it was the first time many businesses were able to open in a long time. Some others were able to increase their capacity from the 50% to the 75%, only to be pulled right back this week. Restaurants in particular are a very highly regulated industry. As more and more of the business pullback occurs, more people are going to turn to unregulated gatherings such as house parties and other social gatherings. The more that happens, the less we'll be able to control it. In restaurants in particular, we're already doing things like frequent sanitation, temperature checks, health screenings, social distancing. So allowing the people to continue to partake in this highly regulated industry is more of a control.
And what Dr. Ryan, Dr. Reagan, Dr. Cook has already said as well, I mean, there's the barriers that we must pay attention to, but there's also a personal responsibility, as I mentioned earlier, as well as respect. I hear, I see, I read all the arguments about why folks don't want to do that. But the fact of the matter is we're here tonight, and I really thank the city manager. I really thank Mr. Atkinson for getting this together so that we can ask the public to really pay attention to the experts that are talking about the physical needs when it comes to both the healthcare workers and everybody else. It's just one of these opportunities that we can make a difference if folks will really step up and put their own desires behind for at least a period of time that we can get past this spread. It's really worth considering. So obviously, again, strongly encouraging people to just go out at this point in time and do the right thing.
Thank you both. Next, Director of Public Health, Katherine Wells.
Thank you. I just want to reiterate that the health department has been contact tracing and working to control the spread through those efforts. However, we can't just contact trace ourselves out of this. We need individuals to be masking, to be practicing social distancing, and to be following the guidelines of their physicians or the nurse practitioner, whoever tested them for COVID. We need everybody to be following those guidelines, or we can't get through this. And we're going to continue to see an increase in the number of cases throughout our community.
Thank you, Katherine. Next, we have some words from Mayor Dan Pope.
Thanks, Lacey. I just want to thank everyone for participating, both the panelists, and we got a lot of great questions. And I know we have a lot of citizens that are very much engaged, and this is important to them. Much like Dr. Reagan a minute ago, I think it's important that we pause and express our sympathies to the families that have lost loved ones. There's been too many deaths from COVID-19. We also have families like Mr. Berry talked about that own businesses, or more likely where mom or dad works in the business, and they are being impacted by this in a way that means they can't provide like they would like to. We have an opportunity to make good decisions. We talked earlier about limiting outdoor events to 10 or less. You will see a more active presence from the fire marshal's office, from LPD, from the sheriff's office, as Judge Parrish had already mentioned. We'll work closer with our event centers. We'll work with TABC and with our bars. We've got to do this the right way. So many of our problems are not in our huge events. They're at birthday parties. They are when a group gets together for happy hour and they cram 10 or 12 around a table. Let's make good decisions. I'll close with 4 things. We can win this battle by applying good old West Texas common sense. You know the safety protocols. We've talked about them today. Wash your hands, keep your distance, cover your face. Third, don't hang out with people you haven't been hanging out with. We're social beings, but we need to be disciplined in the way and where we spend our time and who we spend our time with. And finally, let's be hopeful. There are better days in front of us. Take care of our neighbors. Take care of yourself. Let's take care of our community. Thanks, Lacey.
Thank you, Mayor Pope. Now we have Councilman Steve Massengill.
Thank you, Lacey. Everybody tonight is tired of the coronavirus, and I'm going to guess that you're tired of hearing from us on the coronavirus. And maybe some of you wonder why you keep hearing from us. And it's because we continue to fight for, I think, two important things. One is we continue to fight for our health care. The fight. Our healthcare workers are overworked and they're under-resourced. And we've got to make good decisions. You know what to do. And if you're someone that chooses not to do what's right, don't be selfish. We can do this. The mayor mentioned it, the good West Texas common sense, our pioneering, the pioneering spirit that runs through all of us out here in West Texas. We do not like to be told what to do. I don't like to be told what to do. But we know what's necessary to get through this, and there is a brighter day. So don't take your healthcare industry, don't take your healthcare workers for granted. Healthcare is not a click away like everything else. There's no prime delivery on healthcare. And we're so lucky to have world-class healthcare here. We've all got to work together to make sure they're available when we need them. And we've all got to work together to make sure that we keep our economy open. So I know we can do it. Thanks for watching tonight.
Thank you, Councilman. And tonight we'll close with Judge Curtis Parrish.
Well, thank you, Lacey. And thank you all for participating in this town hall meeting. For those who have brought in questions, these are the questions that we're asking ourselves on a day-to-day basis. So thank you. And thank you for participating today and for all the panelists. As many of you know, as county judge, I wear two hats. I am the administrative function as the CEO of Lubbock County, and I've got administrative duties. But I also I'm the probate judge and guardianship and mental health judge for the county. A couple of weeks ago, I had a probate hearing, and a gentleman came in and his father had passed away a couple months ago, and we were probating his father's estate. And we were talking about COVID and how COVID has affected us. And he said something very profound. And I've kind of bound this into my heart. And I want to share this with you. He said, my father didn't die of COVID, but he was a victim of COVID. And that's really hit hard to me, because while we're talking about those who are in the hospital, we're talking about those who have passed away, while tragic that is, folks, we are all victims of COVID. I want to share one more thing with you if I can. I don't know if you can see this or not, but today was the first day that I've got to visit my mother, who's in a nursing home here in Lubbock. Today's the first day I got to visit with her face to face in 7 months. She is alone. She is lonely. We talk on the phone, but when you're dealing with your mom, phone calls sometimes aren't enough. Today is the first day I got to hold her hand. Today is the first day I got to look in her eyes and tell her how much I love her, and she to tell me how much she loves me. Folks, we are all victims of this COVID disease. And we need to do all we can do to make sure that this disease does not impact us even more than it has right now. We're at a tipping point. And this tipping point can only tip the good way if we're all in this doing this together. So I plead with me, take care of this community. And in doing so, we'll take care of all of our moms, all of our neighbors, all of our nurses, our doctors. We'll take care of our restaurant owners. We stand together, we'll fight together, and we'll win together. Thank you.
Thank you, Judge Parrish. That's all we have for tonight. We thank you so much for joining us, and thank you all to submitted questions. And a big thank you to our panelists tonight for offering their insights. Remember, for all coronavirus resources information, you can find that at mylubbock.us/COVID-19. Have a good night.